So you're a practicing nurse. You're in the trenches, you've got the experience, and you're probably asking yourself, okay, what's my next move? Well, the answer could very well be the Post Basic B.Sc in nursing. Now, this isn't about going back to square one. Not at all. This is about leveling up. Today, we're going to dive into the 2-year syllabus that's designed to turn experienced nurses just like you into the next generation of healthcare leaders. We're going to break down the entire 2-year journey. First, we'll cover the basics of what this program is all about. Then we'll get into the first year, which is all about sharpening your clinical skills and really seeing the whole patient. After that, we'll explore how year 2 broadens your focus to the community and leadership, really charting that path from practitioner to true nursing professional. All right, first things first, let's be crystal clear about who this program is for. This is not Nursing 101. It's a path specifically designed to take all that amazing real-world experience you already have and build right on top of it. It's all about elevation. And that right there is the whole idea. The entire curriculum is set up not just to feed you more information, but to help you reframe what you already know. It's about empowering you to think bigger, to innovate, to specialize, and to step into those leadership roles that really shape where nursing is headed. This is why the entry requirements are so specific. It's a 2-year course, and it's built for registered nurses and midwives who already hold a diploma and have been working for at least a year. You can think of it as a career accelerator for people who are already in the thick of it. Okay, so let's get into year 1. The first year is all about deepening that clinical core of yours. It takes the skills you're using every single day and backs them up with a much deeper understanding of the science that makes it all work. You're going to see some familiar subjects here, but trust me, you're going way, way deeper this time. You're not just learning the how, you're mastering the why. A class like Nursing Foundation, for instance, isn't just about rules. It's about digging into the entire philosophy of care. And right from the jump, the program gets you thinking conceptually with this idea called the meta paradigm. It sounds complicated, but it's actually a really simple, powerful way to see the big picture. It teaches you that it's never just you and a patient in a vacuum. It's always you, the patient is a whole person, their unique health situation, and the entire environment they live in. And here's the system you'll master to put all that thinking into action. The nursing process. Assess, plan, implement, evaluate. This framework basically takes your professional intuition, all that gut feeling you've developed, and turns it into a structured, evidence-based method for delivering the absolute best care possible. But you know, year 1 is not just about the hard sciences. It immediately pushes you to widen your lens, to see the patient not as a set of symptoms, but as a whole person with a life, a family, and a story. And this bigger picture is built through a really smart mix of subjects. You've got maternal and child health, which cover crucial life stages. Then you have psychology, which gives you incredible insight into your patient's mind. And of course, nutrition and dietetics, which adds that fundamental layer of how diet impacts everything. And hey, this isn't just classroom talk. Look at the sheer amount of hands-on, practical time. We're talking 300 hours in medical and surgical, 240 in maternal, and another 240 in child health. This program makes absolutely sure that all this new knowledge gets put to use in the real world, right away. Okay, let's jump into the second year because this is where a really interesting shift happens. Your focus literally zooms out from the patient in the bed to the community and the society that shaped their health in the first place. This really sums up the progression, doesn't it? Year 1 makes you a sharper, more knowledgeable clinician at the bedside. Year 2 turns you into a powerful advocate for health out in the world. It's a move from the micro to the macro. And the subjects totally reflect that new, wider lens. Sociology gives you the framework to understand how society works. Community health nursing gets you out there, applying that knowledge on the ground. And mental health nursing tackles one of the most important and often forgotten parts of a community's overall health. This is the huge aha moment. You start making these incredible connections between things like income, education, or family support, and the health problems you see every single day in the clinic. You start thinking about prevention, about root causes, not just treating the symptoms. And the final piece of the puzzle in year 2 is all about leadership. See, it's not enough to just understand the system. This part of the program gives you the actual skills to change it for the better. This is really the capstone of the whole journey. These courses are basically your leadership toolkit. Nursing education teaches you how to train and mentor the next generation. Nursing administration gives you the know-how to manage teams and departments. And nursing research gives you the power of data to push for real, meaningful change.
You can even see this leadership focus in how you're graded. Yeah, there's a big emphasis on education and administration theory, but look at that. A huge chunk of your grade comes from a practical research project where you have to take these new skills and use them to solve a real problem. So when you put it all together, what do you get? Over these 2 years, the syllabus guides you through this incredible transformation. You walk in with amazing hands-on experience, and you walk out with this strategic, big-picture view of the entire healthcare world. And that's the ultimate goal, right? You don't lose your clinical expertise, you amplify it. You gain this amazing ability to influence policy, to lead teams, and to make a lasting contribution to the nursing profession on a whole new level. And if you ever had any doubt about what this program values, just look at the hours. It's almost double the practical hours compared to theory. That tells you everything. This program is rooted in the real world of nursing, and it's designed to create leaders who don't just know things, they do things. So when you look at it all, this is so much more than just a list of classes. It's really a blueprint for the future of nursing leadership. And the only question left to ask is, are you ready to help build it?